In the effort to end the COVID-19 pandemic, more than 150,000 doses of the virus vaccines have already been administered so far in the state of Wisconsin. But we're not nearly as far along as many state health leaders had hoped. News Watch 12's Megan Mamlock spoke to Oneida County health leaders today to learn more about their plans going forward. She joins us now live in studio with more. Megan?
Thanks, Justin. Today, DHS announced the beginning of next week, they'll move into phase 1B and will be able to vaccinate eligible first responders, police, and fire departments. Meanwhile, state health leaders, along with Governor Tony Evers, are asking the federal government to increase the amount of doses they receive each week.
This is a seamless way to begin our movement into phase 1B. Since our police and fire departments are already working so closely with EMS and our local and tribal health departments across the state.
So far, Wisconsin and many other states have had trouble simply getting the COVID-19 vaccine to all people who desperately need it in the phase 1A group. But health leaders say by increasing the size of the pool, they'll actually be able to speed up the process.
When our vaccinators and the spokes have a certain amount of vaccine, let's say they have 100 doses and they expected 100 people to show up at a clinic and only 80 showed up and they have 20 doses left over. They're going to quickly call people in phase 1A, see if they can come in and get those doses.
But not all those vaccinations are local health departments' direct responsibility.
Phase 1A, we are vaccinating unaffiliated healthcare workers. They're not working at Aspirus or Ascension or Marshfield Clinic. So what we did, we started vaccinating like our EMS providers, our volunteer fire departments, volunteer first responders, a couple of dental clinics, and we're continuing to do that this week as well.
To help streamline the process, the Oneida County Health Department meets weekly with local pharmacies and health providers to determine how they will move forward in the next steps so they are not duplicating services.
We discuss where are we at, what are we doing, and what are we going to order for the next week. Walgreens has been working on the long-term care settings, and they will be working on the assisted living settings as well. And I know Triggs is also a vaccinator, and we've been in communication with them.
Wisconsin has a high population of phase 1A people, which consists of healthcare workers, long-term assisted living facilities, and residential staff of skilled nursing facilities. So we have a higher percent of people to try to get vaccinated in the early round than most other states. Justin?